MEC for Health and other members of the Executive Council will be visiting maternity wards across the Free State province to congratulate new mothers and their precious bundles of joy. Mangaung Executive Mayor Gregory Nthatisi will also welcome babies born on New Year's Day at Pelonomi Hospital. SABC News reporter Makgaka Masiteng is there for us and joins us live with the very latest. Happy New Year to you, Makgaka. I'm sure everybody there is already quite jovial. It's a new year, but also the moms get to welcome their bundles of joy. Just talk to us about the experience that is there.
Compliments, Mfundo. Yes, everyone here seems to be excited. Actually, at the moment, we are in Tabanju at JS Makgaka Hospital, and here they have delivered 2 babies. And Premier, of course, is here. She's been monitoring the hospitals just to welcome the newborn babies. Let us bring her in. You went to Pelonomi first. How was the mood there? How many babies have you welcomed today?
We welcome 4, 3 from Pelonomi. The 4th one was from one of the clinics around Mangaung. The mother had some complications. They were brought to the hospital, so she is now part of the team that we counted in the hospital at the Pelonomi Hospital. And so we had 4 in Pelonomi. We had 2 in National Hospital. Here we got 2, awaiting 1. We are told that we can just wait for a few minutes. I don't know whether it's minutes or it's an hour, but they said few minutes. Plus minus 30 minutes, we'll be receiving the 3rd bundle of joy. But let me also share this. What saddened me in Pelonomi was that on the Christmas Day, we left about 3 mothers who were not okay. Those mothers had some complications. But what we were told today was that we lost a mother and a baby from the ones that I saw on Christmas Day, who were really, the conditions were really not pleasing. When we visited the hospital, we lost that, but the 2 survived. They are discharged, they are at home. So today, when I visited the hospital, no complications. It's only the one that was brought from MUCPP, but she's been stabilized. She's in the ward. I met her, we talked, and then she said, no, she's fine. And the treatment that she got at the hospital really was pleasant. And what also pleases me as a Premier of the Free State is the response that I got from some of the patients there. There's a patient that comes from Karipa district who said to me, hey, Premier, the Pelonomi has improved. Please just tell the MEC to keep it the way it is. So I'm happy that the treatment that they got, all of them were happy. We're also joined by SANCO officials of the province from SANCO civic organization. And I was happy to see them because these people belong to communities. From hospitals, they're going back to communities. So I was happy, and the team was of men. It was constituted of men. And I said, I hope from here you are going to talk to other men to take care of these beautiful newborns that are here today so that they grow up having father figures. So I was happy to see the leadership of SANCO really visiting with us, visiting these patients, the babies, the mothers, sorry. We don't call them patients anymore, they're fine. So I was happy really to see them joining us in these visits. So we are hopeful that going forward we'll have men who will really take responsibility as well, making sure that when we address this issue of GBV, that you know I'm passionate about, we address it from here where we are. I'm happy that the father is next to the mother today. It's another fan support and hope that you are here on day 1 when your partner is giving birth. You are starting to bond with the child from day 1. I'm very happy to see such couples.
Thank you. We've heard of issues in the past of young children or young adults rather giving birth, which has really been a concern. What have you witnessed in the Free State so far since Christmas?
On Christmas Day, we witnessed one young person. I think he was 17 from Petersburg area. It was difficult because the mother gave birth, yes, but she doesn't have documents. Home Affairs are here at hospitals. They are issuing out birth certificates on the spot, but they could not help. And what was said about the story as well was that the very same mother is an orphan. So it's a process now for her to have an ID. But what I did immediately was to call the ward councillor and call one of my officials, the CDW, who resides in that area, who works in that area. And they know the story, and they promised that immediately after her discharge, they'll be able to visit her and assist. And I also called the Home Affairs, who were able to engage and say, this is what we are going to need for you to have your birth certificate, to have your ID. So we are calling upon our leaders, as I spoke to councillors recently, please help us to address some of these challenges. We know teachers at schools, they try their best, but when a child is an orphan, we all know that it's a process. We need some relatives, we need people who will be able to testify, who will be able to assist to acquire the certificates and so on. So we are hopeful that as we begin this 2026, we'll have to have a campaign where we go to schools and really sensitize our young people not to really have babies at this age, especially those who don't even have documents. But if they can just prioritize school, and then we'll be able to look at mothers being mothers later on. But you also need to talk to our boys at school as well, because when we look at some of these young people are giving birth, fathers are also learners at school. But in the case of Petersburg, it was not the case, because it was now someone who's a bit older than the mother who gave birth. It's also a problem that we really need to address, but it needs families, so that we engage families. There are people who don't believe that you can't have a 16-year. Last year when I was here, a 16-year gave birth here in this hospital. And immediately I said to nurses, why don't you call the parents and call the law enforcement? Because we couldn't just take it that a 15-year was going to turn 16, is giving birth here, and someone is even older than him, and he was not even around. So we communicated with the family. The family, you have to take steps. So unfortunately, during that time, I was told by some officials that the family was not that cooperative, but I said it's no longer about them. Now we have to get in as government to assist them to understand that it is not allowed. You cannot impregnate a 15-year-old child. So the law enforcement came in, and I left the matter in their hands.
Okay. And of course, today you came bearing gifts, and do we have the boys or girls here?
It's boys. This year, it's boys. Even at Pelonomi, we only have one girl. I don't know what's happening, but it's boys this time around. Last year, we had, I think there were girls, but this year it's boys. And some of us like pinkies, like boys, like girls. But it is what it is. What is important is to have healthy babies and healthy mothers. That's what is really of interest to us. But nna ke rata banyana.
Thank you very much. That is Premier of the Free State, Makhwelitswa Matai. I just want to bring in either the mother or the grandmother just to talk about how they are feeling now that Onalisi Tloholong Khon, we could Rajanka Jennifer.
O ke ikutlwa ha monate hore ke na le banana ha se banana kwa ka ana penenyana e tsetsa sa o ke itumetse hore.
Thank you very much. That is the grandmother there saying that she is really excited that today she has a grandson, because she has many girls. Of course, those are the mothers of the two boys that were born today here at JS Moroka. Just a few words, don't you want to say how are you feeling?
Yeah, nna ke na mantjise gas. Ke ngwana wa wape? Ke ngwana ka wa ntla. Ke thabile haholo, and surprisingly gore ke hlaile ka di 25 tsa December and no hlaile ka di 1 tsa January. So ke thabile haholo.
Thank you very much. That is the mother there just expressing her excitement. She says she doesn't really have words, and what is surprising is that she was born on the 25th of of December, and now her son is born on the 1st of January. I just want to bring in another mother here. How are you feeling? We could jwang fela?
Ke ikutlwa ke thabile fela ke tshwere ngwana ka fela ke utlwa fela ke thabile haholo lo bona premier.
Were you expecting hore o tlo ngwana tlo hlaka jeno ka pono sa tsebe?
Ne ke sa tsebile ne maobane.
Oh, okay.
Jwale ha ke thabile hlele ka tsatsi la pele selemong.
O mmitsa mang?
Ke bokamoso.
It's ke ngwana hao wa pele?
Ke ngwana ka wa pele. Moshimane.
Thank you very much. That is the mother there of the first child. He is a boy. She's just expressing there that she is very excited, of course, to have welcomed her baby today. She was actually expecting that the baby will be born or would have been born yesterday, but of course she's excited that he was born today, and excited also to see Premier coming to welcome this newborn baby.
Excitement all round, even though the Premier was hoping she'll see a little bit more girls. I suppose it's evening things out, where we're seeing a number of boys now born in this century. Makgala, thank you very much for that reportage. That's SABC News reporter Makgaka Masiteng out in the Free State for us in tow as the Premier visits maternity wards.